Hello teacher, I'm Natalie Ventura Torres. I'm going to talk about pituitary hyperplasia from primary hypothyroidism. These are my accounts. Please check them because I will upload medicine content. First, the definition. Thyroid hormones act through a negative feedback mechanism on the hypothalamic secretion of TRH. If the thyroid gland secretes an insufficient amount of thyroid hormones, TRH levels increase. This elevation could eventually result in hyperplasia of TSH, producing cells and growth of the pituitary gland. Untreated primary hypothyroidism can lead to irreversible pituitary injury, which can lead to a deficiency in one or more pituitary hormones. The incidence of pituitary hyperplasia in a patient with hypothyroidism varies between 25 and 81%. Manifestations. It manifests with menstrual irregularities, frontal headache of 1 to 2 months of evolution, nocturnal, progressive, not associated with bone migrant, galactorrhea, or hypothyroidism.
Been told you've had a pituitary lesion, the first thing to understand is the normal anatomy in this area. You have to remember the pituitary gland measures about the size of a kidney bean and sits right at the base of the brain, right above the earlobes and right in the middle of the head. And it controls all the hormones in our body, and that's why we call this the master gland. And as lesions, whether it be a tumor or a cyst, grow within the pituitary gland, I kind of break it down to 3 problems they can cause. The tumor itself, because it arose out of the pituitary gland, can actually make one of the hormones the gland makes. And these are called secreting tumors. They can cause syndromes like hyperprolactinemia, elevated prolactin levels. They can cause Cushing's disease or acromegaly. However, later in life, the majority of these tumors do not make any hormones. So then as the tumor grows, the second thing that happens is the gland gets compressed. 2 things can't live in the same space. And so whereas the average tumor size may be the size of a walnut or a golf ball, you can imagine taking a golf ball and squeezing it into a kidney bean. What happens over time is the gland gets compressed. And as you slowly squeeze the gland, the hormones the gland makes slowly shut down. Typically the first hormone that's lost is growth hormone, hence why in kids, short stature is one of the most common symptoms that develop. However, after puberty, we don't grow any taller. And so even though most adults will lose growth hormone, they'll be asymptomatic. The next hormone that shuts down are the sex hormones. So in women, it causes premature menopause. That's why oftentimes we'll catch these tumors when they're smaller. In men, the same thing happens, but they lose their testosterone. And unfortunately, as is most of the case, we kind of write this off and saying I'm getting older, or that's not oftentimes picked up. The third hormone that shuts down is thyroid, but you really need a large tumor and a loss of a lot of gland before you lose that hormone. And the last hormone to shut down is cortisol, which is a steroid hormone. Now, thyroid and cortisol are both hormones of metabolism, and so it makes sense that the last 2 hormones your body is willing to give up. But all these hormones have to be evaluated in all patients before we consider any treatment. And the last thing we worry about is that the tumor outgrows the cavity, which is called the sella turcica, that it sits in. And so it starts pushing on other structures, the most important of which are the optic nerves. Right above the pituitary gland are the nerves that go from the eyes back to the brain, carrying all the visual information. And as these tumors grow, they can slowly stretch those nerves and cause progressive vision loss. Now, the body is pretty adaptive. Since these tumors grow slowly, there are some patients who will lose up to 50% of their vision and still not realize it. Eventually, once it starts affecting central vision, people start noticing vision loss, and that's when we oftentimes diagnose these tumors. But by that point,
Applications in medicine. This pituitary hyperplasia associated with hypothyroidism responds well to treatment with levothyroxine, allowing the resolution of hypothyroidism and the clinical signs associated with it. Surgery should be reserved for the decompression of the optic sheaths or to obtain a pathological diagnosis. In the case of a pituitary tumor that doesn't respond or wasn't despite replacement with thyroid hormone.
To describe inadequate output of thyroid hormones by the thyroid gland. There's a few different causes. The most common cause of hypothyroidism in the developed world is Hashimoto's thyroiditis, and this is caused by autoimmune inflammation of the thyroid gland, so the body's immune system attacking the thyroid gland. It's associated with antithyroid peroxidase or anti-TPO antibodies, and also with anti-thyroglobulin antibodies. Initially, it causes a bit of a goiter, after which there's atrophy of the thyroid gland as the hypothyroidism sets in. Iodine deficiency is the most common cause of hypothyroidism in the developing world, and this is because iodine is essential for the production of thyroid hormones. Iodine is added to foods like table salt to prevent iodine deficiency and to prevent hypothyroidism. Hypothyroidism can also occur as a result of treatment for hyperthyroidism. So all the treatments for hypothyroidism have the potential to overshoot and cause hypothyroidism. So these are treatments like carbimazole, propylthiouracil, radioactive iodine, and of course thyroid surgery. There are also medications that can cause hypothyroidism. Lithium inhibits the production of thyroid hormones in the thyroid gland, and so can cause a goiter and hypothyroidism. Amiodarone interferes with the thyroid hormone production and metabolism, and usually it causes a hypothyroidism, but it can also cause a thyrotoxicosis. There's also secondary causes.
Pros and cons. Pros. 3 months after starting levothyroxine treatment, a decrease in pituitary volume was observed. The regression of the pituitary tumor may occur in the short term, approximately after 4 weeks of starting treatment. Cons. Neurological symptoms secondary to solar expansion may occur. After a long time of evolution, pituitary hyperplasia can produce irreversible lesions in the pituitary, which can lead to the deficiency of one or more pituitary hormones, such as hypothyroidism.
Disorder is a pituitary gland tumor or abnormal growth. Pituitary tumors are actually fairly common in adults. And joining us in studio is a pituitary expert, Mayo Clinic endocrinologist Dr. William Young. Welcome back to the program, Dr. Young.
Thank you, Tracy. Glad to be here.
Dr. Young, so good to have you to talk about the master gland. So it's about the size of a grape, but summarize for us all of the different things that it does.
Right. So
it's 50 minutes or less.
50 minutes. I can do this. It's a small grape. It's about the size of your thumbnail. Sits straight behind the bridge of the nose and just in front of the ears. It's at the base of the brain. And I describe it to patients as if it's a small cherry hanging down from the brain on a little stem. So it's not brain tissue, it's a gland tissue. And it does 4 big jobs in all adults. It tells our thyroid gland to make thyroid hormone every day. If we don't make thyroid hormone, everything slows down, the heart's slower, no energy, constipation, and eventually you can go into a coma if you don't make any thyroid hormone.
Well, really, I thought the thyroid regulated itself, but obviously not. The thyroid is regulated by the pituitary.
Right. Without a pituitary gland, the thyroid would not work. Yep.
Amazing.
That's why the pituitary is the master gland.
So we got the thyroid.
Yep. And
pituitary tumors.
Headaches are very common, period. I mean, it's very common in the general population. And it's sometimes it can be quite difficult to distinguish whether the headaches are related to the pituitary tumor or whether the headaches are just headaches, as most people get headaches. But there obviously is an association between some headaches associated with the pituitary gland. And certainly in the studies that have been shown that certainly headaches is usually one of the major reasons why people present and to the doctor and are found to have a pituitary tumor.
So how do you go about determining that, if it's related to the pituitary gland or a tumor?
With difficulty sometimes, because obviously treatment for the headaches typically would involve treatment with medicines first. And I think sometimes the only way to know really is to have the surgery, and then if the headaches disappear, then we know truly for sure whether the headaches are related to the pituitary gland. But this is a very difficult subject.
Issue applied in Ecuador. The incidence of pituitary hyperplasia in primary hypothyroidism has not been clearly identified, but recent literature suggests that it may be more common than previously accepted. Ecuador has a high prevalence of hypothyroidism.
pituitary tumor in and of itself is a generally benign tumor. 99% of them will be benign. It presents in a focal area of the nervous system, that is, the pituitary gland itself. And the pituitary gland itself controls all the endocrine function of your body. The thyroid gland, the adrenals, how a woman ovulates and whether she can conceive and have a child. So it's multiple diverse, and the tumors here can affect a myriad of different symptoms that a patient may have. And that can overlap with a lot of other symptoms as well. But specifically, a benign tumor that grows by size alone, that is not making something that the patient would ordinarily cause side effects in the patient, but the size of the mass alone almost always presents with one of two ways. Either the pituitary gland quits working, that is fatigue, malaise, general patients don't feel well, they don't have any energy. That would be one of the diagnoses, would be pituitary failure. And the other would be blindness, that is, a person begins to lose vision, specifically out on the periphery of their eyes. So those two things, they just don't feel well. They don't have any energy, they're run down. Of course, that's a common side effect of most everything else. And visual loss would be one of the ways a tumor that's not making something and its size alone would present. The other would be the tumor itself is making something. Specifically, that would make something that would cause the patient, alert the patient that something is wrong. So that prolactin, it can make prolactin, and a woman would start lactating at the breast, knowing that something was wrong if she were not nursing a child. Or hyperenergy, putting on weight gain with stria in the abdomen, running high glucose, high blood pressure, things that occur over a short period of time will clue the patient that something is not right, I don't feel well. Other entity that might grow might cause growth of bones, the jaw would enlarge, the facial tissues would enlarge, and that's called acromegaly in an adult, giantism in a child, and that is whatever it's making is causing a physiologic sequelae, which the patient would alert them to the diagnosis, and they would seek treatment by their physician and generally be referred to an endocrinologist. So those two ways is how pituitary.
Conclusion. Primary uncontrolled hypothyroidism has been described as a precursor of pituitary hyperplasia. It results from the loss of tyrosine feedback inhibition and the subsequent overproduction of thyroprotein-releasing hormone. Imaging with CT or MRI may not be able to reliably differentiate between an adenoma and hyperplasia, and biochemical testing should guide diagnosis and management. Thanks for watching my video.